and welcome to the 2021-2022 school year. I am Jamie McCormick, the Health and Nutrition Coordinator, and I am sure that we were all hoping that COVID would be a thing of the past by now, and we wouldn't be having these conversations again, but here we are. If you attended our program last year, you will notice that some of our policies have stayed the same while others have been modified. All of the information that I'll be sharing today is located in our Health and Safety Handbook, and you have access to this handbook on our app. It'll also be in our newsletters, and a copy will be sent through email. Since the coronavirus has begun, there have been many unknowns, and information and guidance is changing frequently. And so due to this, our health and safety protocols can and will likely change as we gather and learn more information. All the content that I'll go over today is based on best practices and is informed by the CDC and the Office of Head Start. Our approach to COVID-19 prevention is a tiered approach, including mask use, physical distancing, hand hygiene, cleaning, ventilation, and vaccines. Today, I'll go over some of the frequently asked questions and what policies and procedures we will start the school year off with. First off, hand washing is still the most important way to minimize the spread of communicable diseases, including COVID-19. Hand washing is required upon arriving at the center, when entering the classroom, before and after meals or snacks, after toothbrushing, after outside time, after going to the bathroom, when putting on a face covering, and before taking off face covering, after blowing your nose, coughing and sneezing, after using the sensory tub. So children will be directed to a hand washing poster for visual cues, which will be posted in the bathroom. Staff will ensure that children are washing hands with soap and water for 20 seconds, including between the fingers, the thumb, and under the nails. If soap and water are not readily available, an alcohol-based hand sanitizer with at least 60% alcohol can be used, and that's located in the first aid backpack away from children. A mask, even a cloth one, reduces your chance of spreading the infection to others. While cloth face masks are not medical grade, they may be helpful to contain coughs and to remind people not to touch their face. Ideally, cloth masks have at least 2 layers of fabric, and it should cover your nose and mouth without large gaps. While wearing a mask may prevent you from spreading COVID-19, if you have it and don't know it, physical distancing and frequent thorough hand washing are still the best ways to avoid getting COVID-19. At our centers, all individuals, regardless of vaccination status, must wear a mask indoors. Exceptions to this include during meal times, during nap times, during outside time. And our decision to require masks was based on CDC and Head Start recommendations, since all Head Start children are not yet eligible for vaccination, and there's increased community transmission of a variant that spreads more easily. Masking is effective in reducing transmission of the virus and protecting those who are not vaccinated. We will provide masks to all staff and students. If parents or guardians prefer to bring one for their child, they can leave it at the center to be laundered at the end of the day, or they can provide a clean mask each day. Each mask should be labeled with the child's name using a permanent marker. And each child will get a second mask to use if the first one gets dirty during the school day. Please self-monitor for symptoms at home to ensure you or your child is not ill before coming to school. It is recommended that you take your child's temperature before arriving. This year, we will not be doing temperature checks at the door. Temperature checks as part of the screening process, it requires more time. It's difficult to screen in cold weather, and not all individuals who have COVID-19 have a fever. However, we will continue to perform a daily health check at the door to confirm that staff and students are healthy under current COVID-19 protocols. All people entering the building will be screened, and staff will ask parents or guardians the following 2 questions upon arrival each day. The first question is, does your child have any symptoms of COVID-19? That symptom list will be posted near the door and includes a fever, shortness of breath or difficulty breathing, persistent cough, muscle pain, chills, sore throat, new loss of taste or smell, congestion or runny nose, diarrhea, nausea or vomiting, and headache. The second question staff will ask is, has your child been in contact with anyone known to have a lab-confirmed case of COVID-19? If the answer is no to both of those questions, then your child is welcome to join us for the school day. Before we dive into the illness policy for COVID-like symptoms, I wanted to review our general illness policy. The overlap between COVID-19 symptoms with other common illnesses means that some people with symptoms of COVID-19 will be ill with something else. This is even more likely in young children, who typically have multiple viral illnesses each year. Therefore, in addition to our COVID-19 illness policy, we also have our regular illness policy, which is shown here on the screen. And this document is located in your parent handbook, which you should have received in your initial parent paperwork packet. And then we have our COVID-19 illness policy. And just as a reminder that our staff cannot determine if your child has COVID-19, but we will monitor for symptoms. And if your child becomes ill while at the center, the children's parent or guardian will be immediately notified to come pick up the child. The child will be separated from the group to a designated comfortable space with pillows and blankets, and those items will be washed once the child has been picked up. The parent or guardian or other emergency contact must pick up the child within 30 minutes of the phone call. The center will then remain open if the child is ill but is waiting for test results or has COVID-19 symptoms. The center must be informed immediately if a child is diagnosed with COVID-19. The classroom that the ill individual attended will be closed immediately and will reopen with the guidance of the local health department. If a child has symptoms of COVID-19, they can return to the center when they are symptom-free for 48 hours, or if symptoms persist, a child or staff member should see a doctor for further evaluation and then be cleared by the doctor. If a child tests positive for COVID-19, they can return to the center if 10 days have passed since they first appeared and they're fever-free for 24 hours, and then symptom-free. And if those symptoms do persist, then the individual can see a doctor for further evaluation. If a child has a lab-confirmed positive case of COVID, but they have had no symptoms, they can return to the center once 10 days have passed since that test result. Additionally, if a child has had known contact with someone who has COVID-19, they should monitor their health for symptoms during the 14 days after the last day that they were in contact with that individual, and they should not come to the center for 10 days. If a child is waiting on COVID-19 test results, they should quarantine until they receive those test results and should not be in the center. For visitors and parents, the number of people who enter our building will still be extremely limited, and we'll continue to limit non-essential visitors, volunteers, and activities involving external groups or organizations. This means that parents and guardians will be met at the door when dropping off or picking up children. I wanted to briefly touch on how we'll be keeping the environment clean, and we'll be sanitizing frequently touched surfaces every 1 to 2 hours. This includes doorknobs, switches, tables, chairs, counters, bathroom counters, and sinks with a bleach solution. Additionally, counters, tables, chairs, and other surfaces will be disinfected at the end of the school day. Surfaces and toys will be sprayed until wet and will be allowed to air dry while no children are present. Clean visibly dirty surfaces. We will be cleaning visibly dirty surfaces with soap and water prior to disinfecting. Toys that cannot be cleaned and sanitized will not be used. And a soiled toy tub will be available at each center, and those toys that have been in a child's mouth or contaminated will go into this tub. Toys in that tub will be cleaned at the end of the day with soap and water, rinsed, sanitized, and then air dried. The bleach solutions are effective for 24 hours, so new solutions will be made each morning upon arrival. So that wraps up the COVID-19 health and safety protocols presentation. So if you have any questions, please email jhorst@thehdc.org, and we look forward to having your child join Head Start for the 2021-2022 school year. Thanks so much.